So somebody's got this, whether because of lifestyle or genetics or a combination thereof. Uric acid has built up over time, and they've developed these crystal deposits in their joints. And now they're having a flare up, and it hurts. My understanding from the little bit of research I did is that it can be debilitating. It can be something that just puts you in bed until it passes. What can be done in the moment to help people with those flare-ups? Are there medications that help? Is there anything that can be done lifestyle-wise in the short term?
Yeah. So on the base level, you're always striving to make lifestyle changes. You're not going to maybe lose a ton of weight overnight, obviously. So all of those things and watching your diet and, striving to consume less alcohol or less of a certain type of alcohol, all of those things are happening at the foundational level. And again, it's more so this idea that there's an inborn error with the metabolism of purines.
Right.
That's kind of at the base layer of this.
Yeah.
And it's the dietary choices and those sort of things that can kind of put somebody over the edge or lend itself to an attack, but it's not going to be the end all be all. And so to recenter, you want to do what you can, do whatever you can to resolve how hideous these flare-ups can be, in the shortest amount of time as possible. And so with that said, within the first 24 hours of symptoms, that's when you want to get started on, some of these different options.
Okay. All right.
So in general, if you can do that, you can clear the flare or the attack, so to speak, within 1 to 2 days.
Okay.
And maintain joint function and prevent additional complications and that sort of thing.
What are those? What are the steps you can take?
So definitely can ice. Okay. So as soon as you notice this, you can begin to ice the area. That can help.
And that helps reduce inflammation? Okay.
Definitely. And just reduce pain.
Okay.
So these are just quick, easy ones.
Yep.
Fluids, not sugar sweetened beverages, not necessarily diet beverages, but just water.
Okay.
You want to do what you can to improve blood flow and, avoid. This is a good time to avoid alcohol.
So no Jack and Coke, drink lots of water. Okay.
And now to the more heavy hitters, in a more mild to moderate situation, if this is maybe one or a couple smaller joints, they'll often use NSAIDs as treatment. So this is ibuprofen, naproxen, and then also indomethacin is another prescription NSAID, which for a long time, had been considered kind of the gold standard NSAID for gout flares. Or depending on the situation, if those are contraindicated for any reason, you could consider a systemic corticosteroid, so something like prednisone, which can help. In more severe or in more instances of severe pain or multiple larger joints that are affected, you might see a combination of medications being used. And this would be, again, NSAIDs, so ibuprofen, naproxen, indomethacin, or something called colchicine, which is Colchris, the brand name. It's been around for a little bit, been around for a good while at this point. It's FDA approved for the treatment of acute gouty arthritis and can be used in it's really used for the short-term prevention of additional flares.
Okay.
During the initiation of another class of medications, which we'll talk about. So you're treating it with the anti-inflammatories, whether that's maybe an injection, oral NSAIDs, oral corticosteroids like prednisone.
That's all to reduce inflammation.
Yes, and to try to get somebody out of pain and just kind of nix this thing as soon as possible.
Right.
And then while that's happening, again, if it's a more serious case, you might start something like colchicine, which is to hopefully prevent additional flares. So while you're treating this acute flare, maybe you add something like colchicine, you're also looking at, your clinician is looking at who would be a good candidate to initiate more of a maintenance therapy at this point. Cause you don't just want to always be reliant on, well, it'll be fine. I'll just take a couple steroids for a few days and then I'll be good to go.
Yeah.
Well, you still have to again, address sort of this underlying issue that we've talked about. And that's that elevated uric acid that's ultimately led itself to these depositions in the joints. So who is a good candidate in this case? So at this point, if you've had multiple attacks, or if you've already been established to have gouty arthritis, then you would be a candidate for one of these medications. If you have 2 or more attacks per year, that was a cut point at one point. And then there are some other instances where that would be indicated: chronic kidney disease, stage 2 or higher.
Somebody who has gone to the doctor, they've had an acute attack, they've been prescribed NSAIDs and colchicine, whatever else. The longer term solution or actions that a practitioner is going to probably suggest are.
Mm-hmm. Yeah. So while managing the acute attack is obviously of utmost importance at that time,
right,
you need to be thinking about the long-term outlook of this, because while you can manage flare after flare after flare, which you'll ultimately might have to do,
right,
you need to go one step further. And not that you're going to cure this by this class of medication that we're going to mention, but this is the kind of the gold standard at reducing that serum uric acid to a level that matters.
Okay.
And so the xanthine oxidase inhibitors, which that enzyme in particular, by inhibiting that, you essentially just, reduce the amount of uric acid that's being produced.
That makes sense.
It cuts right to the,
that's
to
nice.
The part that matters.
It's nice to have a medication that does exactly what you need it to do.
Exactly. So allopurinol has been around for 1 million years.
Okay.
That's the one that we see most commonly. Uloric or febuxostat, that one has been around not quite as long, but I don't see a ton of that at this point.
Yeah.
Just because allopurinol, it's generally well tolerated. It's inexpensive at this point. And there's a lot of flexibility with the dosing.
Okay.
So it's, I know a lot of people are reluctant to maybe get started on something like that in a maintenance sense, but with how vicious this can be, it's a viable option. So you'll usually start at a very low dose and you'll titrate sort of as tolerated, and you will have your serum urate looked at frequently to see if you're moving the needle.
Right. Okay. And because you don't want to just let this ride, because you will have another flare up, and it will happen at the most inconvenient time possible. Mm-hmm. It's not like it waits for you to go on vacation.
Yeah. And like I said, you let this kind of ride and this becomes a chronic gout.
Yeah.
Again, we talked about kind of the hallmark look of certain joints that can get worse to the point where there's almost a deformity that can start to occur as the cartilage and the bones in that area are just, sort of changed to the negative by the presence of the uric acid deposits. Kidney stones, you're at a higher risk of kidney stones because those urate crystals, they don't just go to your joints, so
it is related.
It is 100% related.
Wow.
Kidney disease and therefore kidney failure, so you let these urate crystals build up. They manifest as these deposits. And then also they can damage the normal functioning of your kidneys.
So this can be, to some extent, an early warning sign of much more severe things down the road. Mm-hmm. Wow. So let's pretend, Miriam has come in. She's picking up her first prescription for colchicine. She's got some excess body weight. What is it that we would suggest for her? Are there alternative supports that can help? Is there lifestyle? There's obviously some lifestyle changes that need to be made. Mm-hmm. What is it that a rheumatologist or a practitioner or even just somebody who's well-informed and wants her best would suggest?
Like anything, this is a holistic approach, to management. So getting over the hump, you want her to get over the hump with the acute attacks.
Right.
Do what you need to do on that standpoint. Consider some of these other options. There's probably, if these attacks have been, again, on a more frequent basis, you want to try to remain as compliant as you can with with one of those new meds that maybe they started. But additionally, continue to exercise.
Yeah.
I mean, we're always talking about the old exercise. That's a prime example. I'm not sure that it's doing something specifically to the joint or the presence of the urate crystals, but from my understanding, you're not going to do any additional harm by continuing to exercise, although it might be very difficult. So in the same sense that you would be managing low back pain or a shoulder injury or a foot injury, those same principles would apply as you're dealing with an acute attack or in the aftermath of an acute attack. You have to do what you can to tolerance, but there are very rare instances where we would say, just lay down for 5 days. That there's very few conditions where that's the ultimate solution. So that's a big one. There are definitely some, we talked about the dietary implications. So avoiding certain meats, organ meats, high fructose corn syrup, lowering sugar in the diet, which we could advocate for anybody to do.
Right.
And a lot of these are, these are hard changes to make. There's no denying that. Losing weight, hard change to make, something that you're going to have to take, that's going to take time. And there's going to be plenty of ups and downs. In addition to medications, I don't really think that it would be harmful to consider a handful of different supplements. There are a lot of the supplements that we have specifically, they contain things like turmeric and tart cherry extract. And there's a celery root extract and certain kind of heavy hitters in the supplement world. If, on a quick search that you'll see may or may not have some benefit in terms of gout relief. Yeah. So you can ultimately do those things in tandem with what you're already doing. Again, I don't believe that something like gout relief or one of the products that we have, if your uric acid is, 8, 9, I don't know that those are going to necessarily be the things that put you into, below 5 or below 6, which is often the target here. But doing those in tandem, if you have an attack or if you just, like doing some additional anti-inflammatories, those are certainly options.
Yeah, it makes sense. That makes sense. It's not a pharmacological therapeutic dose, but anything to help reduce the chance of dealing with these flare-ups is worth considering.